interesting topic and a very important topic about therapy. So there are so many names that we hear nowadays around us with the word therapy, and therefore a common man would definitely fail to understand which are medically recommended therapies and which are the therapies meant only for relaxation or relief from some amount of tiredness or those things. So in this video, I'm going to specifically highlight and explain about the word therapy, and I will specifically talk about how occupational therapy is not just some therapy which is option kind of treatment, but I will tell that occupational therapy is a medically recommended therapy. So the word therapy means treatment. In medical field, treatment and therapy are synonyms to each other. So when an occupational therapist is giving therapy, it means the occupational therapist is treating. Now that we hear spa therapy, this therapy, that therapy, so many types of therapies, flower therapies, bash therapies and those things, those are meant for relaxation or relief from tiredness or relief from mental tiredness when you are too much into your own thinking and you want some relaxation, you go for those things. But when it comes to occupational therapy, it is not something that is for relief of some tiredness. It is a medically recommended treatment line for people having some diagnosis or who have gone through some disorder. When I say occupational therapy, I mean that the person who is holding the title of occupational therapist is not just someone who has done a certification course or who has done some workshop and is now dealing with the clients. But occupational therapist is a healthcare professional who has taken proper medical degree from a proper medical college, and then he is treating the patients. So what kind of patient does occupational therapist involve himself with? Are the patients will have deficits in their occupation, in their everyday things that they are doing, like cooking or taking bath or brushing themselves or going to the office, doing some calculation. The person, I mean, if we talk about children, then ability to write, read, attend classroom sessions, go along with other children, play with them, be comfortable in their playgrounds and explore, keep learning. Whenever somebody is having stroke or one side is paralyzed, then ability to use that side again, or to modify the environment or modify the person himself so that he can do his tasks again. So occupational therapist usually does all of these things for the patient. So this is not an option. Whenever a person is having a diagnosis or disorder, he is recommended to go to a therapist. And this is not something like if you take it is better, otherwise you do not take. If you want your patient to heal back, if you want your patient to be functional again, then occupational therapy is a must and is a recommended mainstream treatment line. So occupational therapy, physiotherapy, speech therapy. So people who come out with these degrees, they are not just some other people who have done some workshop or certification in something and are practicing with the clients. But these are the people who have gone to medical school and taken proper medical education and training for handling cases of their respective professions. Now you come across terms like hippotherapy, play therapy, hypnotherapy, and many other therapies, and then movement therapy. And you say that a person having Parkinson's disease does well with movement therapy. I want to take movement therapy, or children with autism does well when they receive play therapy. So I want to take play therapy. So discuss with your therapist any of these three. Since I'm an occupational therapist, I would recommend that discuss with your occupational therapist and talk about that specific therapy you are interested in knowing about. Many a times what happens, like in play therapy is a word which is often used by occupational therapists in their day-to-day sessions with children. They say that play therapy is a part of their therapy treatment management. So that won't be something you have to specifically go out of way and look for those things. Though there are people having certificates or courses done on play therapy. So talk with your therapist first. Know your resources. Know what is available in your community and what is the best thing that you should be doing for your child. Since occupational therapist has been learning and is academically trained to handle these terms and terminologies, it is always advisable to talk to your therapist and do not just keep on hunting around you about various words that you come across. Whenever you come across anything, it is always advised go to your occupational therapist and talk. Then you will listen something about psychotherapy, which is very common and we hear about it every day. Psychotherapy is given by psychologists. Psychologists are people who deal with mental health and they do their MA. They are not trained in medical schools, but they are trained how to do psychotherapy. Psychotherapy is basically talk therapy, counseling. They talk with the patient across the table, but that is not what an occupational therapist would do. Occupational therapist would use psychotherapy also in their treatment session, but that won't be exclusively psychotherapy. It will come with some other things that occupational therapist is doing with the client. So psychotherapy is different. The therapy given by psychologist is different, and the main therapies that I talked about, occupational therapy or physiotherapy or speech therapy, those things are different. So understand what is just therapy and what are professionals with the label therapy. Occupational therapy, physiotherapy, speech therapy. These are professionals and rest are the techniques. So I hope I have clarified it, and if you still find that I should elaborate more on something, do let me know.